Hi, everyone. My name is Kate Cohen. I know it's been a little while since you've seen my face since I've been on maternity leave, but I'm excited to be back and see you all and be able to work with you all again. And I do want to just make a note that this meeting is being recorded. So if you have colleagues who you think would find it helpful, you can definitely share it with them. I'm gonna send it out after today, so you'll have access to that. I'm also excited for Andy Worcester to share with all of you the shared risk and protective factors dashboard that he's been working on in Colorado. But before we get started, I just wanted to share a couple of quick reminders. So you probably saw the email from me. Colorado is going to be holding its annual Shared Risk and Protective Factors Conference in June. I know last year, many of you were hoping to attend it in person, and we changed it to a virtual conference. And this year, we're doing that from the get-go, obviously. So would love to see you all there. And on Tuesday, June 8th, we're also going to have our annual meeting. So I'll send out many more details to come, but just save that date, June 8th. And again, I'll send out more information in an email. And for right now, don't worry about the fee when saving that date. It shouldn't be an issue for peer-to-peer members. So definitely that shouldn't be a hurdle for you joining, but the registration for the conference will open next month. So I will send out a reminder, but I think mid-March it should be out. And we're gonna have some really great keynotes and sessions. And I'm looking forward to diving into a deeper conversation with you all at the annual meeting, just like last year. So please be sure to look out for more information about both of those meetings, and hopefully you can make it. Also, just as another reminder, please don't hesitate to reach out to me if you ever have resources to share with the group, or if you're interested in leading a future webinar or session during our meeting. I would really love to hear from you. You know, we have 4 webinars a year and that annual meeting, and I think everyone would love to hear more about what folks in different states are working on. So please don't hesitate to email me about that. And then at the end of this webinar, I'm going to send out a survey in the chat box, and then also I'll send it out in an email. And it is always really, really helpful if as many of you can fill that out as possible, so that we know what we're doing right and what we can improve for next time. I'd love to get feedback. But I would love to introduce Andy, who's an epidemiologist and data visualization manager with the Violence and Injury Prevention Mental Health Promotion Branch at the Colorado Department of Public Health and Environment. It always feels like such a mouthful introducing anyone. But over the years, he's done a lot to bring our data visualization up to date and make it more accessible for people to access, and for us to also to just use within the branch. And, you know, we do a lot of work, and I know Andy does, continuing to think about the best ways to do this for different audiences here in Colorado and for other out-of-state partners like all of you. So I'm excited for everyone to learn more about his work with our data dashboard. And yeah, I can definitely send out the link to all of these webinars. We actually have them all on a website, along with a technical assistance request form. So I can definitely send that out. Thanks for flagging that, Stephanie. And so Andy, I'll turn it over to you now. And if you have anything to add to introduce yourself and for your presentation, also feel free to type questions into the chat box, and we'll have time for Q&A at the end. Let me stop sharing so that you can have the floor, Andy. Do you need anything from me, like access to anything? Andy, you're on mute, just so you know. I think you should be good now.
Okay. Can you hear me?
I can hear you, but we just can't see your screen. Oh, yes, we can actually. You just need to, yeah.
Okay.
Perfect.
All right. Sorry about that. It was a little technical difficulty where I have 3 screens in front of me and it went to the 3rd screen that I never used. So I apologize for a rough start here. As Kate said, my name is Andy Wooster. I'm an epidemiologist and the data visualization manager for the Violence and Injury Prevention Mental Health Promotion branch here at the Colorado Department of Public Health and Environment. And I'm here today to share a little bit about our shared risk and protective factors dashboard that we've been developing for quite some time. I'll start by kind of telling you what the impetus was for its development and then walk you through the process of selecting indicators for the dashboard, the design process, and then give you a little bit of a tour of the dashboard. We'll have a chance to debrief a little bit after seeing the dashboard. I'll give you an opportunity to ask some questions and talk about some of the challenges and opportunities of creating a product like this. And hopefully you'll all get a chance to weigh in and provide some feedback throughout this process. I will say that I do like to keep my presentations relatively informal. So Kate, if you can monitor the chat and if people have questions, please feel free to jump in. And I will try to address any questions that come up. The other thing that I will say, I know Kate mentioned that she may have baby noises going on in the background of her presentation. I, in this work from home environment, am expecting a FedEx package, which will undoubtedly lead to 2 giant dogs barking incessantly at the door behind me. So if that does happen, I apologize. Okay, so here's a little bit of background about the impetus for developing this shared risk and protective factors dashboard. So Colorado has been talking about applying a shared risk and protective factor approach to address injury and violence for more than a decade. I would argue we're probably now coming up on closer to almost 2 decades that we've been having this conversation. And around the time that I started in the branch, which was November of 2015, subsequent to that in 2016, we updated our violence and injury prevention branch, mental health promotion branch strategic plan to focus our work on 5 overarching protective factors. We sometimes call them super protective factors. We sometimes call them shared priorities. We've learned, I think, over the course of our time talking about shared risk and protection that the terms can be jargony, and we sometimes slip between historical ways of talking about them. I'll try to stay consistent today in talking about our protective factors. Over here on the right of this slide, you can see the 5 protective factors that at that time we decided to focus on. I'll talk a little bit later about how some of that has changed a little bit as we've continued to move this work forward. But over here on the right, you can see connectedness, good behavioral health, positive social norms, economic stability, and resilience were the 5 overarching protective factors that we decided to focus on for our strategic plan at that time. This is just an image of our high-level logic model that was part of our strategic plan at that time. And so it described the resources that we were going to use to implement strategies here that you can see, help strengthen policies, systems, and environments, influence healthcare systems, engage communities, enhance surveillance and evaluation to ensure all Coloradans are connected to, and this will look familiar from that last slide, these icons that you see here, are connected to caring support networks, communities that support healthy and safe behaviors, coordinated resources and services, and have positive social norms about help seeking, making healthy and safe choices, gender roles, violence and injury prevention being a community responsibility rather than individual or family responsibilities. That sort of idea of it takes a village. And then experience good behavioral health with decreased substance use, social and emotional health resources and services, access to mental health and substance use services, experience economic stability through employment policies that support health, safety, and families, increased economic opportunity, and are resilient. And ultimately, the idea being that if we strengthen policies and systems through the information that are the inputs to this system and increasing connectedness, positive social norms, et cetera, we can reduce our outcomes of violence and injury outcomes of overdose, motor vehicle injuries and fatalities, suicide, bullying, sexual violence, et cetera, across the lifespan for all Coloradans. So you can kind of see how we were coming at this. And one of the things that we recognized early on is that, as I mentioned in the last slide, shared risk and protection can be pretty jargony, and not everyone who's not well versed in the subject, which I assume this group is, can have a really hard time imagining what it is that we mean by economic stability and supports as a shared risk and protective factor. And so one of our goals with this project, the dashboard project specifically, was really to operationalize our strategic plan and these ideas of shared risk and protection that we were focused on. So how did we achieve this, and what did we do? The dashboard, we had two work groups essentially. We had a content work group and then a smaller data work group, and they met on a bi-weekly basis from about June 2017 to April 2018. Our data group is still meeting on a periodic frequency. So I think we're scheduled to meet about once a month, and the content work group is meeting probably annually at this point. And we really set out over that period to determine what the process would be and to outline our goals. We defined terms. Some of those terms you'll see here in a moment. And then to select indicators and data sources. So we kind of came in as this large group. Several people who were part of that group are here on the call today. And everyone sort of brought their ideas about what these indicators could look like. And then we made decisions about which of those indicators to keep. Some of those were made because either they just weren't valid indicators based on the content expertise of the group, or the data group took a look and said, oh, that's not going to work because it's only available for 1 year and only at the state level. So why would we continue to collect that data point? And then that group of data folks, several of my esteemed colleagues who I will be forever indebted to, went about the process of going around and collecting those data sources from all of our publicly available secondary sources that we were getting this data from. At the time, we had a contractor from another unit within CDPHE or within the Colorado Department of Health who was helping us to actually build the Tableau infrastructure. I was just learning Tableau at the time. If you don't know, Tableau is a data visualization software. It's pretty flexible and pretty neat, and I spend a lot of time in my current role as the data visualization manager working in it. After that, I kind of took over both the data management side and the dashboarding side of this project. And then we continued to populate the dashboard with the selected indicators. So to date, we're just actually finished up with the second round of data collection for this project. I had started it probably in December of 2019. It takes a long time to collect all of the indicators for this project, and then was deployed, I think, beginning in March of 2020 for 5.5 months to the COVID response for the department, which of course set us back in our timeline. But I just finished up the second round of data collection and got most of that data implemented into the dashboard. So why did we do this? The intent for creating the shared risk and protective factor dashboard was really multi-tiered. And I think I already said it. It really, here the first bullet point says explain the VIPMIP strategic plan, but it really helped us to operationalize the strategic plan. And there were a lot of benefits that came from operationalizing that strategic plan. One of those being that last bullet point there that says the provision supports the provision of technical assistance. It really provides a way for us to describe to grantees and/or partners around the state or around the nation who may be less familiar with the idea of shared risk and protection for injury and violence outcomes, what indicators they could be using. And on a limited basis, and we'll talk a little bit about the challenges for doing this later on, it could be used to inform program planning, because essentially what we've put together is a community profile based on the violence and injury prevention mental health promotion branch's vision of what shared risk and protection for our injury and violence outcomes look like. And so you could take a look from a county perspective about what our branch has decided we think are important from these secondary publicly available data sources about economic stability and support within your community, and could find areas of focus for upcoming program planning for your community. And then, of course, if we have all of these metrics in one place, another thing that it could be used for is to evaluate progress and monitor trends and the indicators for risk and protective factors. And so it could be used for evaluation purposes and to determine what the effective implementation of that program planning effort actually looked like in the end. And so what was the outcome of this effort? The group met and we went through, I think, about 250 different indicators that were suggested, and ended up with, I think, 142, so almost 150 indicators of risk and protection for violence and injury outcomes. And these cross 25 different publicly available secondary data sources. All of them aren't completely publicly available. We do have to make a couple of data requests in order to get access to some of this data. And some of that's a little bit fluid and changing over time, and I'll talk about that a little bit more in the challenges and opportunities section down the road. But essentially, we've got 25 different data sources and 150-ish different indicators that are represented on the dashboard right now. They're currently available at the state level, county level, and regional levels. Some of them are available only at the state, some are available at state and county, some are available at state and regional. Here in Colorado, we use a geographic grouping called the Health Statistics Region, which I'll show you in a minute when we demo the dashboard, which is essentially aggregates of counties. Some of our larger counties are their own health statistics region. Some of our more rural counties, there may be 6 or 8 counties that make up a single health statistics region, and often they're intended to look quite similar to one another. So it just provides another level of detail that we can look at data and affords us an opportunity to look at some other data sources. Some of our sources are only available at that health statistics region level, and of course those are Colorado specific data sources as well. The indicators are organized by broad categories under each of those shared protective factors that we talked about previously, and then the dashboard is pretty flexible and interactive, as you'll get a chance to see in a minute. Here's a list of the data sources as of today that are currently in the iteration of the dashboard. So we got several different components of the U.S. Census Bureau. So American Communities Survey, County Business Patterns, Current Population Survey, Survey of Business Owners, the Annual Business Survey. We've got data from the Colorado Behavioral Risk Factor Surveillance System, or BRFIS, Colorado Child Health Survey, the Department of Education, Department of Regulatory Agencies, Department of Revenue, the Colorado Health Institute, the Smart Source Survey, which is a survey of school administrators in Colorado, the Equal Employment Opportunity Commission, Feeding America, which is a nonprofit, Healthy Kids Colorado Survey, which is Colorado's version of the YRBS, Measure of America, another nonprofit, the National Council of State Legislatures, the National Survey of Children's Health, and NISDA, or the National Survey on Drug Use and Health, Penn State Department of Agriculture, who produces the Social Capital Index, if anyone is familiar, the University of Washington Center for Women's Welfare, who produces the Self-Sufficiency Standard, which is a really neat kind of alternative to the federal poverty threshold, and then the U.S. Bureau of Labor Statistics for some of our unemployment data. So here's an image of what the dashboard looks like today, the landing page for our dashboard. And I'm going to click over here. Let me know if this breaks anything in terms of how you're seeing things on your end. Still seeing all right? Okay.
Yes.
So here's this is a look at the homepage here, and there's a whole bunch of stuff on this homepage that you can sort of notice right off the bat. So there's a couple of different ways that you can navigate this. Here on the top of the page, you can see we've got different tabs. So you can click on these different tabs to navigate to different portions of the dashboard. Alternatively, you can click on these links down here to navigate to see indicators for these different shared protective factors. So social norms, connectedness, economic stability and supports, and behavioral health. And what's interesting here is Tableau affords the opportunity to create these, what they call tooltips, so these pop-up boxes. And what we've done with that is we've entered in some of the definitions that we've come up with for how we're thinking about defining behavioral health. So here you can see the definition for behavioral health when I hover over the icon for behavioral health. And it says behavioral health includes both mental health and substance use, encompassing a continuum of prevention, intervention, treatment, and recovery support services. It is the promotion of well-being by preventing or intervening in mental illness, excessive substance use, and substance use disorders. And so if you're a new user coming to the dashboard and you want to have an impression of what it is that our branch thinks the definitions of these different shared protective factors is, you can hover over these to see that data. So it's pretty neat in that way. The one thing that I will say here is you saw that resilience was one of the shared protective factors that we described initially. As we continued through this process and we began to dive deeper into some of these indicators, we found that there really weren't great indicators, particularly with respect to injury and violence outcomes for shared protection, risk and protection for community resilience. And there were really two reasons for that. Most of the indicators that we could find were individual level indicators rather than community level indicators of resilience for communities. And then the other research that we were able to find around community resilience really focused heavily on resilience to natural disasters or recovery from natural disasters, which didn't neatly align with shared risk and protection for injury and violence outcomes. And so we began to really think about community resilience as the tree that sort of grows from the roots that are being fed by these other indicators or these other shared protective factors, which is behavioral health, economic stability and support, and connectedness and social norms. So if you have these things, presumably or hopefully you would have community resilience or resilience enough to respond when outcomes were not their best. So that's kind of an overview of the layout. We've got a general description here of what the dashboard is. There's also a icon down here at the bottom where if you have ideas about how we can improve this dashboard, you can go in and put some information in there. You can suggest new data sources for the dashboard. So there's another opportunity to provide feedback if you don't necessarily have a direct connection to the people that are doing this work within our branch. So let's take a closer look at what the pages actually look like when you go to access the indicators. So I'll click on the behavioral health link here, and you can see it takes us to a page that's largely blank. And under the heading here for behavioral health, which again is represented by this the icon, and you can hover over that to see the definition again. You can see several subcategories. And so these are the broad categories under which the different indicators reside. So access to health services, access to substances, health education, health service needs, substance use initiation, substance use norms. We have a link to go back to the homepage, or you can do that here. And then we have the ability to select between those geographies I mentioned. So state level estimates, when they're available, are included in each of the health statistics region and the county data examples. And then there's a drop-down filter for Colorado communities, either health statistics regions or counties that you can choose to view. So if I go over here and I click on, for instance, access to substances, you can see the health indicators for behavioral health under that broad category pop up. And so you get an indicator, which is we're calling alcohol outlet density. If you know anything about alcohol outlet density, you know that the measures that we have over here are not true measures of alcohol outlet density. We have a number of licenses from the Department of Revenue per 10,000 population within that jurisdiction. But you can see here, we've got data for 2014, 2015, and 2016. And if you hover over any of those data points, it will give you kind of a summary sentence of what that metric is. And so this one, you can see the data source is the Colorado Department of Revenue, and it gives you a technical definition, which is the number of off-premises alcohol outlet licenses in a given geography per 10,000 resident population. Off-premise licenses allow customers to purchase alcohol and then take it somewhere else for consumption. This includes liquor stores, wine stores, grocery stores, and pharmacies that sell alcohol. And so you can see that for Arapahoe County, that number was estimated to be 5 per 10,000 population, 5 off-premises alcohol outlet licenses per 10,000 population in Arapahoe County in 2016. And so I tried in building this out to, as I try to do with all of my dashboards, give you kind of a one-sentence takeaway for each data point when you hover over that data point to see what the metric is for that particular year and that particular jurisdiction. We also have data points on substance use norms, and over here you can see that now we're seeing some Colorado only data for these metrics. You can see in this case we have a communities that care scale measure of percent of youth at risk for poor health and behavior outcomes due to favorable attitudes towards substance use. And under that, we have the different indicators from the Healthy Kids Colorado survey that make up that CTC scale. So this is kind of a composite index of these different measures. And you can kind of see what those metrics look like. And in some cases, the scales are only available in 2017 and 2019. They were only produced for those 2 years of Healthy Kids Colorado survey data. Under that, you can see some of the metrics have been asked for longer than that. And so you can track what those data points look like over time. Importantly here, you're only seeing Colorado data for these because the data for Healthy Kids is produced at the health statistics region level and not the county level. So we only have the state level data available for that metric. So that's an example of some of our behavioral health data. If you wanted to look at economic stability and supports data, you can click over to that link. You could do that by going back to the dashboard home and going to the icon there. We'll take you to the same blank page where you don't have an indicator selected. From here, you could look at access to food, and what you would see in access to food is some metrics from the Colorado Department of Education around free and reduced lunch, the percent of students who are eligible for free lunch programs, free or reduced price lunch programs, or the reduced price lunch program only. And so you can see, for instance, in Colorado in the 2019-2020 school year, 40.7% of students were eligible for the free or reduced price lunch programs versus Arapahoe County, which is in orange here, where it was 44.5, almost 45% were eligible. So you can kind of get a look for your community to see how that compares to the state rate for many of these indicators. The other indicator for access to food here is from the nonprofit Feeding America, who does an estimate based on some USDA numbers and some American Communities Survey numbers of to generate a household food insecurity rate. And so you can see for Colorado in the most recent year of available data, 2017, 10.6%, according to Feeding America, of the Colorado population was estimated to be food insecure in 2017. And so you can see a little bit how that trends over time. So for instance, in 2015, 12.2% versus 10.6% in 2017. So you can look across jurisdictions, across time, where those different data points are available. A couple other things that were worthwhile to show, I think, on this one. So just to get out a little bit of the nuance of some of these data points and the context, and we'll talk a little bit more about that in just a little bit. If we look at vacant housing units here, so this is an American Communities Survey measure of the number of essentially non-primary residence households within a community. And so you can see for Colorado in general, the percent of vacant housing units in 2011 was almost 12%. For Arapahoe County, which is one of our metro front range counties here in Denver, largely metro. We'll talk about some of that nuance a little bit later on too. This metric was estimated to be 6.6%. Now, what's kind of interesting about this, I think several of us who were on the data team were confused because we hadn't used this data point before. But if you take, for example, and you look at Pitkin County, and anybody who knows anything about Colorado geography won't probably be too surprised by this, but for Pitkin County, the percent of vacant housing units, which is a non-primary residence housing unit, was almost 47%. And so when we did a little bit more thinking about that, we got to realize that maybe this metric wasn't as useful as we thought, but it can still be informative for communities. The reason Pitkin County is so high is because Pitkin County is the home to Aspen, which is the ski resort. And so many of the homes within that community are actually second homes. And so it follows down the line. If you were to select Summit County, where Breckenridge and Keystone ski resorts are, you can see almost 66% of housing units were vacant housing units. And that's not to say that all of these homes are, I think when we were initially thinking about this data point, we were thinking it would be abandoned or dilapidated housing units, and it actually is something quite different. So it really depends on the context within that community, and communities have to sort of be aware of that to understand what these metrics necessarily mean for their communities. So I just thought that was fascinating and a great example of how this data can look quite different depending on the context of the community you're viewing it from. And then one of the other ones that I did mention previously that I think is worthwhile to show is this University of Washington Center for Women's Welfare Self-Sufficiency Standard. So this is a metric that they produce that's based on taxes, cost of groceries, it's basically a cost of living measure, what it have a reasonable lifestyle, essentially, to afford all of the kind of necessities of life. And this one that we selected is a family of 4 with 2 adults, 1 preschooler and 1 school-age child. And here you can see this is expressed as the number of percent of households from the American Communities Survey that are below the self-sufficiency standard for that household of 4. And so you can see in 2015, that number was 47% for Arapahoe County. And for 2019, that number was, or 2018, that number was 50.7% for Arapahoe County. Interestingly, we also prepared that metric as another sort of look on this. And we expressed it as a percent of the federal poverty threshold. And so what you can see here is that in order to be self-sufficient as a family of 4 in Arapahoe County, you would need almost 3 times the income that the federal poverty threshold provides. So 295% of the federal poverty threshold, according to the University of Washington, to be able to live sufficiently within that community. So a really neat alternative to something that we know is just a really bad data point, that federal poverty threshold. We understand, of course, what that is used for, to set policy for a number of programs, but or benchmarks for a number of programs. But this is an interesting alternative to looking at that. And then if we wanted to look at, let's skip ahead here, I'm talking too much. We want to look at social norms. We can see some gender norms. So we have percent of married heterosexual couples where the husband is in the workforce and the wife is not, as a measure of community norms around masculinity. This is, again, I think, derived from the American Communities Survey. We have percent of employer discrimination charges filed based on equal pay over time here for Colorado. Percent of women in legislature, so you can see what that looks like over time. The percent of women-owned businesses comes from a unique Census Bureau product called the Survey of Business Owners and Self-Employed Persons, which is now becoming the annual business survey. And then you can see, for instance, median female earnings relative to median male earnings. And so you can see, for instance, across Colorado, according to the American Communities Survey, women were making 72% of the median female income was 72% of the median male income in Colorado. Then we also have some norms about aggression. So again, most of these are going to stem from our Healthy Kids Colorado survey, which again is Colorado's version of the YRBS. So that's kind of a tour of the dashboard. And let me get back to the presentation here. So in having the opportunity to work on this dashboard now for several years, I have had the opportunity to reflect on opportunities and challenges for the dashboard. I think our opportunities are pretty apparent. So it's a centralized host or repository for indicators of risk and protection related to injury and violence. And we can have these sort of neatly laid out under our shared risk and protective factor categories that we work on as part of our strategic plan. As I mentioned, it could aid in program planning for communities, and it could help with evaluation efforts or in evaluation planning. It operationalizes our strategic plan and demonstrates indicators of that strategic plan. So it really shows people what we mean when we're talking about economic stability and supports as a protective factor. And then it can serve as an excellent training tool for providing technical assistance to some of our community partners and to our internal staff who are providing technical assistance to those partners. The challenges, I think, as I've come to realize over time, one, anybody who's involved with the project to this point knows sustainability is a challenge for this project. It's a big lift when you're talking about 25 different data sources and 140 different indicators. Downloading a different data file from the American Communities Survey for 2011 through 2019 for each indicator from the ACS just takes a lot of time. And then there's a ton of staging that has to go into the process before it can ever make it into Tableau. So I spend a lot of time either downloading data or reformatting data to get it into a format that Tableau can read. So it's a pretty big lift to do this. And then geographic resolution. We have data presented at the county level, and I think at the outset of the project, we were okay with that. I don't remember a ton of conversation about moving to more granular levels of geography represented in the dashboard. I did have the opportunity to see some data presented at the census tract level about healthcare access from our health access branch not too long ago that really neatly showed how delineated access to healthcare was in Colorado. This was specifically for substance use disorder treatment. And it really just showed that if you're anywhere outside the Front Range in Colorado, along that border of the mountains here where Denver, Boulder, Fort Collins, and Colorado Springs are located, you're essentially in a access to care desert. And so it just really did a neat job of showing that and displaying data at the health statistics region level or the county level just doesn't do that quite as nicely. It leaves out a ton of context. And so, for instance, in Arapahoe County, which is where Aurora, Colorado is located, one of Colorado's bigger cities, Arapahoe County is a big county that spans both the Front Range Denver metro where Aurora sits, but on its eastern border, it has Deer Trail, which is a rural town of about 500 population. And so the context between those two places to live is going to be very different, whether you're residing in Western Arapahoe County or in Eastern Arapahoe County. And so geographic resolution can be a real, can really hide some of the inequities between different parts of the geography. And then there's a ton of missing context about what these communities and what inequities look like within these communities. So whether that happens to be geographic, so you got Deer Trail versus Aurora within Arapahoe County, or whether that happens to be looking at racial and ethnic groups and their access within a community and how that might differ from the dominant white majority in most of these communities, or whether that's looking at access based on ability or the experiences of members of the LGBTQ plus community. This dashboard and having one metric that represents an entire county or an entire health statistics region doesn't do a great job getting at different experiences of the residents of those communities. So it can be a great place to start, but if you were going to try to use it for evaluation purposes or for program planning purposes, you definitely would want to be focusing on that context as you're going in. Some of these data sources are available in those different breakdowns or stratifications for demographic characteristics. And so you would just want to make sure that if you were trying to use this is a great jumping off point to have that conversation and to begin to plan, but won't necessarily give you the answer that you're looking for if you're working with a specialized part of the population. So a couple of just things to keep in mind. So we do have some ideas for next steps. One of the things that I'm currently working on is trying to implement some of our, or make the dashboard searchable by outcomes. So for instance, not everyone's familiar with these shared protective factor categories. They don't know to go to look for economic stability data to see the data they want. They would rather come to this dashboard and they would want to see indicators that we believe are tied to suicide, or that we believe are tied to overdose or substance use disorder. And so that's one of the things that I'm currently building into our next iteration of the dashboard. So if you have me back in 6 months, then maybe I'll be able to show you quite a different project or a different appearance for this project. Another is thinking about how we can address some of that some of those context dependent concerns, whether it happens to be related to equity or whether it's revisiting the geographies that we're collecting some of this data based on, and how we can improve it that way. Another thing that I'm sort of looking at, which is in really early phases, is how we use some of Tableau's built-in features to really kind of try to look at how these risk and protective indicators cluster together for communities, and which communities look similar and which communities look different from one another. In Tableau, it appears has implemented some new features that we may be able to utilize to explore that. I don't know enough about them yet to know how they're going to be beneficial. And then I think we're going to get to some questions and time for a little bit of conversation, but I'd love to hear what suggestions you have for future directions. And so before we jump into these reaction questions, I always have to show an obligatory picture of the dogs who, so far, you didn't get to hear barking in this conversation. We had a birthday party a couple of weeks ago, and we were able to get them to sit politely at the table. The dog on the left is a rescue that we just got several months ago now, and that was his first time actually sitting in the chair at the table for our birthday parties, which is a mandatory event or a mandatory activity, as is wearing the hat. So I have some information here that you can use to contact me if you do have questions or you want to reach out afterwards. But I'd love to entertain any questions that anyone has right now, and or any suggestions that people have. I also put a question here about whether your organization has done or attempted to do something similar, and if you have, what takeaways or lessons learned you could share from that experience. Kate, I'll turn it back over to you if I can do it.
Thanks, Andy. And yeah, I love the idea of just opening that up for folks to share their feedback. And if you are going to, just feel free to unmute or share in the chat box, and I'm happy to read it out. But if you can share where you work and what state you're in, that's great too. Would it be helpful, actually, Andy, to keep those questions up, or do folks need that in the chat box, or do you have, if you have other things to add too, that's great too. I know Andy's looking for feedback generally too.
Are you seeing them again, Kate?
Yep, they're up there, thanks.
Andy, this is Jerry Schultz. How are you getting, I mean, I think one of the issues with dashboards is there's so many dashboards, or often there's many different dashboards, and I think people still don't know which one to go to necessarily. How are you disseminating, you know, this to people and kind of directing them to this?
Yeah, that's a great question, Jerry. I appreciate that. Let me see here. So what's kind of interesting about this dashboard is that we are currently not, whoops, that's not what I wanted. We're currently not disseminating this publicly at the moment, largely because the process has just been pretty messy to this point. And so we've had to go back and do several revisions to get it to where we wanted it to be today. And I think we're now getting to the place where we're starting to feel comfortable with releasing it publicly. With that many, I'm grateful for all the hands that have been involved in the project to this point, but with that many people working on it, and a lot of these indicators are complex, you know, it's just been a process of making sure that everything is accurate. One of the things that we have done, to your point, here in Colorado with many of our dashboards, because I have worried about the same thing to a great degree. There's just so many dashboards coming out. We actually built a kind of a centralized location for our health department for many of our outcome, the kind of standard things that we report on. And so you can go to COHID, which is the Colorado Health Information Data Set, COHID, and you can see, if you Google that, it should come up. You can see many of these different dashboards. This is actually a landing page built in Tableau, but each one of these represents a different dashboard that you could go in and access to get information about that topic. And so that's one of the ways that we've tried to do it, rather than forcing consumers of our data to go to program specific pages to access this. Really having a central repository where people can go to access all of the dashboards from the health department has been, I think, a huge boon for staff in terms of not having to answer questions all the time about where can I access this dashboard, and sort of constantly being inundated with those questions. So.
Do others have thoughts or questions? And thanks, Emily. I'm glad that it was helpful and that the strategic plan document's been helpful too for you. I was also wondering if other states have had similar experiences, or if you're doing something like this or thinking about doing something like this, if you have similar challenges or similar experiences to the ones that Andy shared. Has anyone been working on things like this in their states? Or thinking ahead to do so? And as we continue with the Q&A, I'm just going to send out the survey link just in case folks have to hop off early. Oh, Andy, I don't know if you saw this question dealing with how did we recruit our partners or determine which partners to engage?
I don't know that we necessarily, I mean, internally we, I guess in terms of the development of the dashboard, we really only engaged internal staff, and we tried largely to get somebody from each content area to come in and share information about the indicators that they thought would be relevant for their area of expertise, and that specific violence and injury outcome. In terms of engaging partners, we haven't done a ton of partner engagement for this dashboard. I can think one place that we would try to do partner engagement would be in sort of our testing as we roll this out more broadly to grantees and other prevention partners to get a sense of what would be most helpful for them. And in terms of what that process would look like to engage them, I guess we'll cross that bridge when we get there. We're just, like I said, now getting it up to a place where I think we're feeling more comfortable sort of pushing it out there publicly to people to have them sort of beta test it and use it and see what feedback they have to offer about it.
Andy, this is Jerry again. We've done plenty of profiles, but they don't end up on a dashboard necessarily. But and I heard you mention some criteria you've used for inclusion. Do you kind of have a set of criteria that you used, and is that in written form? And could you share that? I'm curious, kind of how what were the decision points for including or not including that? I think I heard a bunch of them, but
yeah, there were several, and I think we should have those fairly well documented. They mostly revolved on they mostly revolved around periodicity of publication of the data point, whether the data point was available for for certain geographies. Those were largely the ones, and the things that we counted out were things that were not going to be replicated. I know there was a survey that we suggested several indicators from that I think funding dried up for, and so we happen to know that it wouldn't be replicated again in the future. And I had another example that I was thinking of. Was one of our surveys used primarily Colorado Department of Education regions, and so that would have added yet another sub-state geography to our list, and so we excluded that data from our data capture for that reason. But yeah, I could try to dig through our notes and see where that list of criteria was, and I'd be happy to share that with you.
Great. Well, since we only have a couple of minutes left, I'm going to just start to close us out, I think. But if you have any more questions lingering, please feel free to chat in the chat box or email me, and I can put you in touch with Andy. But thank you so much, Andy, for this presentation. I think a lot of folks will find it really helpful, both who have been on this webinar, and I'll send it out if you want to share it with colleagues. Please do fill out the survey that I sent. It's just always so helpful to know what you all thought about all this. And then I think the next time that I will see you all is going to be at the annual meeting in June. So I really hope you can make that virtually. And that's going to take the place of our May webinar that we would normally have. But if there are any ideas or thoughts that you have about future webinars, but in particular the annual meeting, things that you'd like us to dig further into or we'll talk about in particular, please reach out to me because I'd really love to hear from you and make sure that it's going to be as helpful as possible for you all. So that is all for today, but I look forward to talking to you all soon, and I hope that you found today helpful. And thanks again, Andy.